During mastectomy, surgeons have to work through one small and crowded space in the upper limb. Get it wrong, and the patient may never fully raise their arm overhead again. So, welcome back to my channel. Today, we are going to learn about axilla, its shapes, boundaries, and everything packed inside it, and why it matters clinically. By the end of this video, it will all make complete sense. Let's get into it. So now listen carefully. Axilla is also called as armpit, which is pyramidal in shape. Now coming to the boundaries and content. Boundaries, you have apex, base, anterior wall, posterior wall, medial wall, and lateral wall. Apex is also called cervicoaxillary canal, and it lies between the clavicle, scapula, and first ribs. Base is made up of skin. Okay. Now coming to, remember a box which contains anterior, posterior, medial, and lateral. Anteriorly you have mainly pectoralis major, pectoralis minor muscle along with clavipectoral fascia. Just remember two muscles, pectoralis muscle, pectoralis major and pectoralis minor. Posteriorly you have subscapularis, teres major, and latissimus dorsi. Posteriorly subcapsularis, teres major, and latissimus dorsi. Now coming to medial wall. Medially you have ribs. You all know that medially you have ribs and you have intercostal muscles. That is, the muscles between these ribs are called intercostal muscles and serratus anterior. Lateral wall consists of coracobrachialis, biceps brachii, and bicipital groove. Okay, boundaries you have apex, base, anterior wall, posterior wall, medial wall, and lateral wall. Now coming to the contents, you have axillary artery, axillary vein, and for nerve you have your brachial plexus, axillary lymph node, and axillary fat. Now we'll see about axillary artery. For any artery you have to know where it begins and where it ends and what are the branches. Okay, now coming for axillary artery, it is a continuation of subclavian artery, and at termination it end as brachial artery. So the beginning is at the outer border of first rib and it terminates at the lower border of teres major. Two important landmarks. Beginning is from the first rib and termination is at lower border of teres major. So the axillary artery is divided into three parts by a main muscle is called pectoralis minor. The first part is proximal to the muscle, second part lies deep to the muscle, and third part is distal to the muscle. So you have to know the pectoralis minor muscle. Proximally is first part, deep is second part, and distally the third part. You have one branch from the first part, two branches from the second part, three branches from the third part. So the first part has superior thoracic artery, second part has thoracoacromial trunk and lateral thoracic artery, the third part has anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. So the axillary artery is divided into three parts by pectoralis minor muscle. First part has one branch, second part has two branch, and third part has three branch. Now we'll see the relations of axillary artery. In this slide you can see three different pictures of the axillary artery which represents the three parts. That is, first part which is proximal to pectoralis minor muscle, second part which lies deep to the pectoralis minor muscle, and the third part which lies distal to the pectoralis minor muscle. So we'll see all the relations, anterior, posterior, medial, and lateral relations to each parts respectively. For the first part, second part and third part anteriorly covered by pectoralis major muscle. For all the parts, anterior relation is pectoralis major muscle. Along with pectoralis major, the second part is also have pectoralis minor muscle as an anterior relationship. So coming for the medial, the axillary vein lies medial to axillary artery for all the three parts, which is a very important point. The vein lies medially for the first part, second part, third part. The vein lies medially to the axillary artery. For second part, you also have medial cord of brachial plexus, and third part you have ulnar nerve, axillary nerve, medial cutaneous nerve of arm and forearm. For the lateral relation, you have for the first part, second part and third part, it's all related to nerve. First part is related to lateral and posterior cords of brachial plexus, whereas second part related to lateral cord. This is a lateral relation, so you have lateral cord of brachial plexus, and for the third part you have musculocutaneous nerve. Now coming to posterior relation of the axillary artery. First part, medial cord is posteriorly, medial cord of brachial plexus, long thoracic nerve is related, and for muscles you have serratus anterior is also related posteriorly. For the second part, you have posterior cord of brachial plexus and subscapularis. For the third part, you have lot of nerve, which is radial nerve, axillary nerve, and do you remember the posterior boundaries? The posterior boundary muscles lies represents the relations of posterior relation of third part, which is subscapularis, teres major and latissimus dorsi. Here you try to note one important point. For the second part, the brachial plexus, you have three cords: medial cord, lateral cord and posterior cord. The posterior cord lies posteriorly to the axillary artery, the medial cord lies medially to the axillary artery, and the lateral cord lies laterally to the axillary artery in the second part of axillary artery. Now we'll see about axillary vein. For any vein, you have to know the formation, termination and its tributaries. Note that for artery it is branches, while coming to vein you have to tell as tributaries. You should not use branches for vein. And another important point, for vein you have to start distally. That is, example here, axillary vein. The formation is by the union of basilic vein and brachial vein at the lower border of teres muscle. Then it terminates. How it terminates? It continues as subclavian vein at the lower border of first rib. Now the tributaries of axillary vein are for vein, the veins always accompany the arterial branch. So now for the axillary vein, the tributaries are superior thoracic vein, lateral thoracic vein, subscapular vein, anterior and posterior circumflex humeral vein, along with cephalic vein. Now coming to axillary lymph nodes. There are 20 to 30 lymph nodes that are scattered in the axilla. According to their location, we divide into 5 groups: anterior, posterior, lateral, central and apical. Do you remember the boundaries? Anteriorly you have pectoral muscles and posteriorly you have subscapular muscle. So here the anterior nodes are also called pectoral nodes, and posterior nodes are also called subscapular nodes. Laterally it is related to humerus, so we call it as humeral nodes, and the central nodes, apical, is also called infraclavicular nodes. Let's quickly recap what we have covered. Axilla is pyramidal shape with 4 walls. Axilla is all about boundaries and contents. So the boundaries are the anterior formed by pectoralis muscle, posterior by subscapularis, teres major and latissimus dorsi, medially by ribs and serratus anterior, laterally by humerus and the muscles biceps. Inside it we have axillary artery, which is divided into three parts by pectoralis minor and its relation, axillary vein, brachial cords, axillary lymph nodes, which matter enormously in breast cancer staging and surgery. And clinically, remember the damage to long thoracic nerve, which is also a content of axilla, gives you winged scapula, and lymph node dissection can lead to lymphadenoma. That's the axilla from boundaries to clinical relevance in one shot. This is just a beginning. I will be covering the entire upper limb region by region. So if you found this useful, hit subscribe so you don't miss what's coming next. Let me know in the comments which structure in the axilla do you always get mixed up. I will pick a few to cover in future video. Thanks for watching and I will see you in the next one.